Good morning. My name is Kalina Duncan, and I am the Director of Partnerships and Dissemination at the NCI Center for Global Health. Thank you so much for joining us today for our Global Cancer Research and Control Seminar Series. This series focuses on talks by researchers and cancer control experts working in global oncology and provides opportunities for discussion and collaboration on impactful and innovative work addressing cancer morbidity and mortality worldwide. I am very delighted to welcome today Dr. Yannick Romero and Ms. Zuzanna Tittenbrun to the Center for Global Health series. Dr. Romero is the Senior Knowledge and Advocacy Manager within the Knowledge, Advocacy, and Policy team at the Union for International Cancer Control, or UICC. His work focuses on developing and gathering evidence-based information for global tobacco control, and he is dedicated to cancer control planning by his work on the technical working group in the International Cancer Control Partnership. Ms. Tittenbrun is a global resource manager within the Knowledge, Advocacy, and Policy team at the UICC, where she manages the flagship Tumor, Node, and Metastases project, which publishes the TNM classification of malignant tumors. Ms. Tittenbrun also works on cancer control planning, managing a web portal for the International Cancer Control Partnership, which serves as a repository for publicly available national cancer control plans. Today, they are joining us to provide an overview of national cancer control planning, the International Cancer Control Partnership, and to discuss the methodology, major findings, and key trends from the 2023 Global Review of National Cancer Control Plans that was recently published in The Lancet Oncology. Before handing over this session to our esteemed speakers, I'd like to review a few logistics for the audience. First of all, please save your questions for the designated Q&A immediately following the presentation. You can ask questions by typing them into the chat, or you can use the raise hand feature found under the reactions button. Second, please note that today's seminar is being recorded and will soon be available on the Center for Global Health website at cancer.gov/global health. And finally, you can find information about future events and future seminars on our events website listed on this slide and by connecting with us on LinkedIn. As a disclaimer, please note that the views expressed in the following presentation are those of the speakers and do not necessarily reflect those of the National Cancer Institute, the National Institutes of Health, the Department of Health and Human Services, or the United States government. And with that, we will begin our presentation with a very warm welcome to Zuzanna and Yannick. Over to you.
Thank you, Kalina and NCI Center for Global Health for this opportunity. And thanks to all of you who decided to join us today to talk about national cancer control planning. It's a pleasure to be with you today. Today's presentation will be divided into 4 sections. In the first one, covered by me, I'll talk about national cancer control plans in general, providing a little bit of background. Then I'll talk about the International Cancer Control Partnership and its role and its works. And then my colleague Yannick will talk about the Global Review of National Cancer Control Plans and also next steps for the partnership and for the portal that we're currently developing. So as a background, a national cancer control plan, so that everyone is on the same page and has the same understanding of the concept of a national cancer control plan. It's a strategic plan based on country situation. So based on cancer burden in the country, based on cancer risk factor burden, and also the resources that are available to implement the plan in the context of the culture and healthcare system in the country. This document serves as a guide to all the cancer control activities in the country. The plan, then CCP, so National Cancer Control Plans, are designed within the context of the country's sociocultural environment and healthcare system structure or an organization. There is no one-size-fits-all model here. And these plans really need to be adjusted to the country's situation. But of course, there are some best practices and guidelines that can guide the development and implementation of the NCCP. You might be wondering why countries need national cancer control planning, and this is a question we get quite often. So the answer is that plans help increase financial, political, and social support, can help maximize use of resources, can help building a partnership around cancer control activities, and are also useful in coordinating efforts in cancer control, but also linking with other health areas so that we can avoid duplication. The plans ensure accountability and also, of course, improve health outcomes. So, for example, countries that have plans, it's been reported that they have better survival rates, for example. So Denmark, that developed 4 consecutive cancer plans between the years 2000 and 2020, has significantly improved the survival rate for multiple cancers. So these are all the arguments for why ministries of health should be developing and implementing national cancer control plans. A national cancer control plan doesn't operate in a silo. It is very important that it is linked to other relevant health plans in the country. It's important that these plans are interconnected because there are many commonalities that can be built on for these plans. So they sometimes they share the same data, they address the needs of the same populations, they can operate through similar messages, and also they're set in a similar setting, and of course the same healthcare system infrastructure. It is very important that that the plans are connected with the non-communicable diseases plans as well, because they share a lot of similarities. They work together on similar goals. It's a way to avoid duplicating efforts and also coordinate messages, materials, and leverage common resources. In terms of content of the plan should address the whole cancer control continuum, starting with prevention and finishing with palliative care, end-of-life care, and of course survivorship. Plans usually are constructed around goals and objectives that should be smart, and also strategies on how to implement all of these goals and achieve all of these objectives. Plans are based on data. There should be equity driven to address the disparities within the country. They should be evidence-based, and they should be regularly monitored and evaluated, and also should be owned at the design and implementation process by a group of stakeholders, so that there is a real ownership of the document that facilitates later on the implementation. So this is the theory. Yannick will tell you a little bit of what the situation looks like in practice globally. But I just wanted to mention that all of this work in the area of national cancer control planning is done in the context of the International Cancer Control Partnership, so the ICCP. The partnership is a partnership that was formed in 2012 by a group of international organizations that were already engaged in the national cancer control planning and supporting countries in their efforts. And the group came together to work together and to avoid duplication of efforts. In terms of the goals of the partnership, we are trying to coordinate and leverage partner efforts to increase global support, political will, and also the country resources for development and implementation of plans. We're trying to collaborate and communicate with countries to exchange evidence-informed approaches to development, implementation, monitoring, and evaluation of plan. And we provide through providing technical guidance, mainly to low and middle income countries, but not only. And then we strive to maintain and enhance the partnership as an effective and credible partnership that shares knowledge, guidance, and leadership in this area. The partnership is not a standalone organization. It is important to note that it's a true partnership. It was formed by NCI and UICC as founding members, but we have over 25 partners at the moment. And we are governed by the steering committee that oversees the work of the working groups, focusing on technical assistance, on the ICCP portal that we'll cover later, on the evaluation processes, and also knowledge advocacy and dissemination, knowledge dissemination efforts. We operate through mainly online calls. We have partnership calls, we have different working group calls, and we try to meet at international conferences and events as much as we can, but we mainly operate as an online partnership. As I mentioned briefly, the ICCP provides technical assistance. As Yannick will explain, one of the results of the global review of national cancer control plans was a tool that we use as a questionnaire to review drafts of national cancer control plans on request by ministries of health. So each such a review is accompanied by a detailed report in which we mention the strengths, the remaining challenges, and also provide suggestions for improvement for ministries of health to take on board if possible. We also, as a partnership, provide assistance with development of NCCPs and also provide assistance in implementation. We can help with updating expired or soon to expire NCCPs, and we can provide expertise and a connection to an expert in many areas of cancer control, for example, in pathology. And also, as the partnership, we run ICCP ECHO program on NCCP implementation. And this program is led by NCI, and it's a mentoring program that focuses on knowledge exchange between national cancer control planners working on plan implementation in their countries. On this slide, you can see country teams that we have over the past 5 years. The program has been running since 2020. And as you can see, we have many teams that stay with us for many consecutive years. So all the resources from this telementoring program are also available on the ICCP portal for viewing. Here I wanted to add that ICCP doesn't work in isolation. We really try to align with different stakeholders. ICCP, as I mentioned, is a partnership of over 25 partners. And we're trying to align activities with UN agencies wherever possible. So we're working very closely with WHO, with IAEA, and with IARC, so that we can exchange information and avoid duplication of efforts. We also publish quite a bit in the area of national cancer control planning. So we try to publish around the importance of cancer control planning, but also findings from different reviews of cancer plans and some analysis. Here are just some examples of papers or blog posts that were developed by the partnership over the years. We also publish sub-analysis linked to national cancer control plans using the data set from the global review that Yannick will be talking about. So this is all from me. Thank you very much, and I'll hand over to my colleague here.
Thank you, Zuzanna. So as Zuzanna mentioned, we have a lot of work regarding technical assistance. And a few years ago, back in 2018, what we've done with some colleagues from from the ICCP partnership with WHO, IARC, and IAEA, we started to review documents in 158 countries, documents that were linked to cancer control, using a questionnaire that was developed by other colleagues from different countries. And that questionnaire was spanning the whole cancer control continuum. And it was a coalition of experts, reviewers, who could look at specific aspects of cancer control component of the cancer control plans. Now, this is just a snapshot of what we've done in 2018 and what we showed as a result. So the plan strengths were in prevention and early detection, but there were remaining challenges from this analysis that we identified, such as treatment and access to treatment, service delivery, or health workforce training and development. But since then, we used that questionnaire and the tool that was developed to perform technical assistance to countries, what Zuzanna just presented. But we analyzed the comprehensiveness of cancer plans. So these are the 11 domains that we identified that could help us to address and to understand the comprehensiveness of cancer plan. But between 2018 and 2023, COVID-19 happened, and a lot of cancer control activities and interventions were put on hold. And we saw that there was a need to improve the strategies around cancer control plans. But also we were thinking about what would be the future of cancer control plans that can help to address the current issues on the ground by the healthcare workforce. So we added a layer on the questionnaire that we had. We added a layer on equity, looking at the vulnerable population, such as aging population, gender, and youth, underserved population. We looked at implementation of the plan, how it was addressed in the NCCP, emergency preparedness that was linked to COVID-19, but also disruptions in the healthcare systems due to conflicts and wars, integration of the cancer control modalities into other strategies. Zuzanna mentioned the NCD plans, but there are other strategies such as vaccination strategies and others. And also data. We looked at what are the data that are available and how the cancer plans were built around data. So we had updated that questionnaire that was used in 2018. We improved it really to better understand what would be the future of NCCPs and to unravel the current limitation of the NCCPs. So this is briefly the methodology that we followed and some of the findings. So we first we made it differently from 2018. Is that time we looked at only either NCCPs or NCD plans, and not every document that was related to cancer plans. So we didn't look at breast cancer policies, for instance, or cervical cancer strategies. We looked only on broader cancer control plans. Each plan was reviewed by 3 reviewers. We had 26 languages into that pool of cancer control plans. 77 expert reviewers from abroad, from every country, almost a lot of different countries, and we have updated that questionnaire. And this is the methodology of the selection of the countries, the country reviews that we've done. We added a specificity to that questionnaire and to the review methodology is that for 2018, we looked at the mentions of certain terms in the cancer plans. And this time, what we looked at is more actionable strategies instead of mentions of those terms. For instance, if you look for tobacco control, if you look for cervical cancer, you don't want to look at only the introduction of a cancer plan. You want to look at what is the strategy to address cervical cancer in terms of HPV vaccination or screening, for instance. We added, as I mentioned, new questions about implementation, universal health coverage, WHO initiatives, and so on. Oops, pardon. And this is just a screenshot of the form that we used for those 77 expert reviewers. We were covering 13 domains compared to the other review, the first review where we were covering only 11 domains. And if you look at the form, we looked at the domain with specific questions with keywords. You can see them here highlighted on the right side. And reviewers could look at those specific keywords and look at the plan in more details, and they can tick boxes, and then we can collect information. All questions were weighted and then scored. This is the methodology that we use, and again, it's really a raw screenshot of what we did. From a Google form, we extracted those data, we analyzed it and scored it. We checked for discrepancies between the reviewers. So there were two additional reviewers of the actual review to check the discrepancies and to reconcile between the original reviewers of the plan. And then we integrated into a database where we could do an analysis according to different criteria that I will define here. This is we made an analysis on different levels. So the first level was really descriptive. Looking at the country, here you have a screenshot of, you have different countries. We use different criteria such as the region, the income level, the type of plan that we use, the population of the plan of the country, and so on and so on. The Human Development Index, the percentage of GDP, the percentage of rural population. So this is the first layer of the analysis. Where are we with those plans according to those criteria? And then there was a second level of we call the granularity, which was more detailed answers that we could provide to those questions. I put here a few examples of the stakeholders which stakeholders were involved in the development or implementation of the plans, or if there were specific answers to commercial determinants of health, such as tobacco taxation, alcohol taxation, and so on. So we had almost 1/3 of the questions where we could make a deeper analysis of the reviews. And these are the first. This is the first level. This is an example of the first level, the descriptive level of analysis that we perform. On the top left, you could see the distribution of plans according to the region, the WHO regions. And in orange, you have the NCD plans, and in blue, you could see the national cancer control plans. What is striking here, and I put a big dark row on it, is that most of the NCCPs from the analysis that we've done were coming from the EU region and less from the other regions. And on the right side, you could see also distribution of plan according to the income level of the countries. What you could see also is that for the NCCPs, most of them are developed in the high-income countries, income setting. So these are the first descriptions that we can, and the first finding that we can show in the paper that we published earlier this year. What we've done also is to look at the different domains, cancer control domains. So I said we have 13 cancer control domains. Here in orange, you still have the NCD plans, and in blue, the NCCPs. We didn't look at health workforce and research for NCD plans. That was a choice that we made with the reviewers and the experts that help us to design the new questionnaire. And what you can see here is that most of the NCCPs scored or have a better index or are more comprehensive than NCD plans in most of the cancer control component of NCCP. This is one of the findings that we obtained for the first global review, but here it's really specific because we only compared NCD versus NCCP compared to 2018, where we had also specific type of cancer strategies included in the review. So as you can see, as a first description, we can extract a lot from the data set with all the different criteria that we used. This is also a snapshot of the elements that we looked at for the global review. On the left side, you have a table summarizing the cancer prevention elements of NCCPs, looking at tobacco and specific strategies, alcohol, physical inactivity, obesity, HPV vaccination, and HBV vaccination. On the right side, you have a table looking at different aspects of the cancer control continuum in those NCCPs. So, for instance, for screening, we looked at cervical and breast cancer screening, almost, well, 90% of NCCPs were addressing or were having actionable strategies for the two modalities. You could see that a low, I would say 50%, but it's quite low. Radiation oncology strategies are present in NCCPs. National EML too, and all we can look at the different component of the cancer control continuum, treatment guidelines, palliative care, and this is just a snapshot. I'll let you imagine that we have used 96 to 100 questions for that questionnaire. We looked at also financial resources because that was one of the main challenges found in the first review in 2018, and the cost and cancer research. We wanted also to look at, this is one of the components that we didn't look into details in 2018, and we wanted to look at who were the stakeholders involved in the development, but also implementation of the plan. So we looked at different categories, 15 categories that were surveyed in both of those questions. On the top of the slide, you could see the involvement of the stakeholders for the development of the NCCP. We could find that Ministry of Health is highly represented, which is normal because it's under the mandate of the Ministry of Health most of the time. Civil society organization is well positioned, academic institution and cancer institute too. But what we found is that the Ministry of Education is less involved, and it's linked to the training and education of the health workforce. The Ministry of Finance also is really is present, but at 8% among NCCPs, as you could see. If we look at the involvement of stakeholders in the implementation, we have government ministries, and most of the time it's Ministry of Health as for the development. And we looked at the same categories, so Cancer Institute, civil society organization or advocacy groups, but also people living with cancer. So in both processes, such as development or implementation, I would say only 18 to 17% of the people are the patients are involved in the NCCP process. Researchers also are represented at the same level. So these were really interesting findings. And here I'm talking about the global aspect, but there are still layers that we can dig in. For instance, we can look at the distribution of those stakeholders according to the region, the income level, the percentage of the GDP of the country, or the percentage of rural population. So this is really a first layer of description. Today, I wanted to specifically focus on research, and our research was addressed in the NCCP in the current review. So we found that globally, only 45% of NCCPs have strategies related to clinical trials. 81% have strategies related to cancer research, which were excluding clinical trials. And 42% of NCCPs have strategies related to funding research activities. So this is a global picture. But when you look at those specific questions, and these are the three bar graphs that I'm showing here, on the top one, you can see the clinical trials and how is it distributed among the different regions. And you can see that there are disparities and inequities in those results. Same for cancer research. So we saw that 81% globally of the NCCPs have strategies. But when you look at the breakdown according to that region, you can see that as for one of the first results, mostly it's in the Euro region.
From phone number 6075.
Okay, I'm hearing something. And when you look on the left side, when we looked at the research funding in the different regions, you can see that there is also better, it's more addressed in the European region compared to the other one. And on the left side, you have the number of countries that we looked at. We also looked at the same questions with looking at the income level of those countries. If you see on the left side, you have the results from clinical trials according to the 4 income level that we identified. And it's striking here that 32% of the NCCPs are addressing clinical trials and less in the other categories. That is a bit more balanced for cancer research on the right side, top right side, where cancer research is addressed more in high-income countries, but I would say a bit less in low and middle income countries and upper middle income countries. Finally, research funding is really less addressed in low-income, lower middle, and upper middle income countries compared to high-income countries, where you can find 24% of the NCCPs having actionable strategies on research funding. So discrepancies in the strategies for cancer research are notable here between countries at both regional and the income level. Oops. So I don't want to go into detail of the 100 questions that we monitored, but we found that financing strategies were better addressed compared to the analysis that we've done in 2018. 7% to 27% is a really good rise in those. But the thing is that it means that you have more than 70% of countries that have an NCCP that don't have actionable strategies to finance the cancer control care. There is a growing focus on monitoring and evaluation. We didn't show it here, but we could see that there is a progress on showing how the plans are followed, evaluated, and adapted to the implementation. There are still disparities. We've showed you that only 50% of NCCPs are lacking radiation oncology and strategies about it. Only 14% of NCCPs have health equity goals, and only 18% have addressed universal health coverage. There are strategies for vulnerable population and social determinants of health, and also commercial determinants of health, but they are very, very low. And as I showed you also, the involvement of the people living with cancer or lived experience is also low for either development or the implementation of the National Cancer Control Plan. Just to tell you that we have a data set. And for the first review, we had a lot of requests, and Zuzanna showed you about sub-studies that were driven by other research groups on access to medicines, on pathology, or on survivorship. And what we've done for 2018 is that we shared that data set for driving and conducting new studies. This time, since 3 to 4 months that we published that paper, we already have more than 22 requests to drive sub-studies from the data set, which is good. We are open to collaboration, and we are really pleased to see all of those sub-studies that are going to be conducted soon. So I invite you, if you feel that there's something that you want to do with the data set, please contact us through either the NCI, our colleagues from the NCI, the ICCP partners, and so on. And we will be really pleased to share with you the data that we developed. But what's next? Well, Zuzanna talked about the ICCP portal and so on. What would be the future of that data set? So first, to share with the colleagues and that wants to publish any research on that. But also we are currently upgrading our ICCP portal to integrate the dataset into a more interactive map, not a repository, but interactive map, showing the scores that were, or the index that was obtained by each country. And that will support cancer planners to develop new plans according to the strengths and also the challenges in their countries, according to their country context. The technical assistance working group will use it for country support. So we currently have requests from countries who wants to develop or update their plan, and we help them in identifying the barriers and facilitators for the development of the NCCP. And we make the data set available for any collaboration. This is just for your knowledge. This is the ICCP portal. There are many resources on it for either development and implementation of the NCCPs. We have plans from 128 and even more now, NCD plans to 900 selected resources. A lot are coming from our colleagues from the NCI and others. So yeah, there are a lot of opportunities for everyone to work with the ICCP. One thing, as I mentioned, is that we are migrating and upgrading our portal, and we will invite you to connect very soon to look at the new portal, the results, and how to better use those data that we published. One last thing is that we are going to have to convene cancer planners in Geneva in May. So cancer planners from different regions and income settings. So diversity and balanced diversity of those countries to share knowledge and experience on developing and implementing their cancer plan. We work together with our UN agencies to really support them in understanding and developing their plan. And encouraging this cross-border collaboration, looking at the best practices in terms of development of NCCP, identification of stakeholders, costing NCCP. We saw that financing was one of the challenges also. So 2 days of a workshop. We have currently more than 50 countries that are represented to the cancer planners. That will be the first of its kind. It's based on a forum that was held a few years ago by the ICCP partners, but here we wanted to have a bit more countries and to have it every 2 years in Geneva, close to the World Health Assembly, where people are gathering and discussing national cancer control plans and other health issues. And that's it for us. Thanks a lot.
Thank you so much, Yannick and Zuzanna. That was a fantastic presentation. Thank you for all of the amazing work on the study, and also for your ongoing partnership in this important work. It is such a pleasure to hear from you today, and such a pleasure to have been able to work with you as the NCI on this. And thank you to our participants. I don't know if you've had a chance to see, but we have had more than 100 people from all around the globe, some familiar names and others who are new. So welcome to all of you, and thank you for joining us. We'll now open up the session for questions. I would invite participants to please turn on your cameras if you're able and comfortable, so we can see one another during the discussion. And as a reminder, I see one question in the chat box already, but please, you can either raise your hand and I'll do my best to call on you in the order that they're raised, or use the chat box to add a question, and we'll pose that to our speakers today. We'll get to as many questions as we can, but we have a good 20 minutes or so for discussion. So maybe I will start. I see Vincent's question in the chat box. Before I read it out, Vincent, I'll give you an opportunity to unmute yourself and ask if you would like. We had you for a minute, but you went back on mute.
All right, sorry. Yeah, thank you, Kalina. So I'm trying to turn on my camera so I can be visible as well. Thank you for the wonderful presentation and great work that you're doing to assist some of us back in the field to develop a review existing national cancer control plan. So my question is specific to and Yannick, you'd know some of the areas where we probably need to improve in the new cancer control plans. So specifically, for example, if health equity is missing in a current plan, and you would know some of our countries may require, guidance to meet certain minimum level of what to include in that. If there's some sort of templates or guidelines or, high level things that you would present to the country so that they can use to consider to improve those cancer control plans. Thanks.
Thanks a lot, Vincent, for that question. Yeah, Vera, we have shared with few countries actually, because that's a recurring question about health equity and how to address it. And clearly we have shared some resources. There are some resources that are present on the ICCP portal, and we will be pleased to navigate you through the portal. But yeah, there are some papers and resources showing how to what are the, and it really depends on the context, on your national context about health equity. When we talk about health equity, are we talking about the populations? Which population are you talking about? And what do you want to address in your country? We know a bit about South Africa. We've been reviewing your NCCP very recently, and we will have a representative of South Africa at our Cancer Planners Forum, by the way. But there are a lot of resources that we can share with you on health equity, how to address them according to the context. Maybe Zuzanna, if you want to add anything.
No, I think you covered it all. Thank you.
Thank you. Thank you, Vincent.
Great, thanks so much. We'll go to two of the raised hands and then come back to the chat. So Stephen Pavletic, if you're able to unmute yourself and ask your question, please go ahead. All right, Stephen, we are not hearing you if you are trying to unmute. Maybe in the meantime, we'll go to...
Is this unmute now?
Yes, sorry.
Fantastic, complicated keypad. Just a quick question. It's a fantastic initiative. So glad I learned about this. One question is, I've seen a number of, obviously a number of countries, now have made progress in developing national cancer control plans, and I've seen many of those, and they're typically very ambitious and often very voluminous documents. And we know that countries vary around the world in terms of local circumstances. Can you elaborate a little bit more this interface between having a ambitious booklet about cancer plan and implementation? I feel that that's a huge challenge, moving from a plan to implementation. Now, when we're going to have probably everybody having a plan, hopefully, can you elaborate a little bit more what tools could be provided, how to make this happen? Because I've seen wonderful plans and moving very slowly into execution.
Well, thank you for this.
I know it's a tough question, but we need to tackle it.
No.
Thank you for this question, and you're absolutely right. There are plans that are very, very long documents that have amazing ideas. But one of the things while we were conducting the global review was looking into implementation matrix. So looking if there is a part of the plan that specifies objectives and strategies to achieve all of these objectives. If there are deadlines for this, if there are key performance indicators aligned with these strategies, if there is roles and responsibilities allocated to each single strategy in the plan. If this was missing, then there is a very little chance that the plan gets implemented. So this would be my short answer to a very, very, very long question that we could probably spend hours talking about, but implementation matrix would be my answer. Would you like to add anything?
There's also, we mentioned it, the ICCPA co-program that is led by the NCI. It's a good example of how countries should prioritize, because they are in the stage of implementing their plan. They develop their nice book, as you said, and now they have to put the priority. So this is where they need to have discussions among them within that committee, between the cancer planners, and where they put the priorities against also the budget that they have. So they make a really beautiful document, but then they have to be realistic. And we ask them from the beginning to be realistic, but how they implement it. And it's really having that discussion with them. That could be a tough discussion, which is, which priority do you put first? And we have some examples from countries where they had a really nice plan, and then they started to, okay, let's think about the budget. Let's think about the infrastructure. Let's think about what we have already and focus on cervical cancer, for instance. They monitor and evaluate it. They look at it, they implement it, and then they can go back to their original idea and say, okay, we've done that. Cervical cancer started to be implemented, HPV vaccination, increasing on cervical screening, and so on. And then that country came back and said, yeah, now we have to update our plan because that's done. It's conducted currently. Let's do the second priority, which is childhood cancer, which is over. So it's really about setting the priorities and being really realistic with them. Thank you,
Great.
Stephen.
Thank you so much, Stephen. That's such an important question and fantastic answer. Gelek, I'm sorry if I've mispronounced your name. Please go ahead and unmute. Go ahead.
Thank you. Yeah, it's Gelek. I'm coming here from Canada, Toronto. So thank you to the presenters and to the organizers. My question is somewhat adjacent to what Stephen just asked, but I was just curious in the context of the new administration and some of the changes that are being implemented here, like how do you anticipate any of this affecting the work that you've outlined? And understand that the question is somewhat maybe sensitive to, because for many different reasons. So if you can think of examples in the past where you've had these sorts of disruptions and how you've had to adjust, it would be good to know. Thank you.
And Yannick and Zuzanna, I'm happy to jump in initially and then offer you an opportunity to speak as partners to that. And I appreciate the question as well. Today, unfortunately, I can't speak directly to the prioritization, but what I can tell you is at the Center for Global Health, we are very proud to work with our partners in the International Cancer Control Partnership on global cancer control and things like the important study that is being presented today. We are fully supportive of the type of scientific collaboration that makes things like this possible and creates opportunities for science that wouldn't otherwise be available. We are very committed to advancing global cancer research through strong partnerships and impactful science, and hope to be able to continue that. Of course, I can't speak to exactly sort of what that looks like. But I also just will use this opportunity. I noted a question in the chat about funding as well. And just to say for today's session, we are here really to focus on the study on NCCPs, and we want to respect the scope of that seminar and the great research that's been done. And so while this is all very relevant and important, I'm happy to follow up sort of after that and appreciate sort of the understanding in that area as well. So I will turn it over to you, Zuzanna and Yannick, from a partner perspective in your organization. I'm sure you have great things to add to this as well.
Well, just to add that, the International Cancer Control Partnership, we're more than 25 partners. So we are discussing it with the steering committee, the current situation, and we'll be happy to work to work. We're happy to work with everyone, with other partners to address the current situation. But right now we're continuing with the work as our work plan as we started at the beginning of the year. So all of these activities are going ahead, and this research will be available on the ICCP portal once we launch the new website in May.
Thank you.
Fantastic. Thank you so much. Venus, hello, please go ahead.
Hi, everyone. Thank you so much, Yannick and Zuzanna, for that presentation. I just wanted to check, it's a follow-up, I think, to Stephen's question. So I think one of the gaps that's there is the plans are there, but the implementation does not get done. So when you get to review the next plan, you realize maybe 50% or more of what was planned was not done. So I wanted to find out if there is any plans to commission studies that track implementation of the National Cancer Control Plan, because now resources are put into developing these plans, but then at the end of the day, they just become documents on shelves most of the time. And I think there is need to then look at the impact of the efforts of supporting the development of these plans to say what are the if there is no movement, what are the challenges, and trying to actually address this. So that's my concern and question all bundled up in one. Thank you.
Thank you, Venus, and pleased to see you on that crowd. Venus is an alumni, I would say. That's a great question. I think there are few country examples where they look at when they develop a new plan, when they develop a new iteration of a plan, they are looking back at what they've done. There are very few examples of that. This is why we said that we looked at the monitoring and evaluation aspect of the plans. If they put that in place and if they can come back and address what they were planning to do according to different aspects, which would be funding, which would be a change in the government and so on, because these are also the barriers for NCCP, for the monitoring and evaluation, is that you have a government and then 5 years after or 2 years after it changes, and then it's really difficult to go back. So there's political will, but also political consistency that you have to look at for the implementation of a plan. But maybe Zuzanna, if you have.
I mean, from what we heard, also the WHO is working on monitoring and evaluation and coming up with some standardized tool or a checklist. We haven't seen a draft yet, but there is ongoing work in this matter. So this should be hopefully available soon. We'll definitely share it with the partnership and on the portal. Thank you.
Fantastic. Thank you so much. Fantastic question, Venus. Thank you. Nella, do we please go ahead and unmute yourself?
Thank you for Zuzanna and Yannick. It's a very great presentations. I have some questions maybe related to a more technical data analysis. So you mentioned about the scoring system during the data analysis. Could you elaborate more on that? And the next question is that, do you use like specific coding scheme or tool to extract the quantify variables from the NCCPs? Thank you.
Thank you. Yeah, we used really high-level statistics from Excel, which means that we scored the response as a yes or no. So 0 for no, yes for 1 for yes. And we also scored according to the different detailed answer that we had. So, and then we put a weight on each questions, and that's it. That's not that we performed classical statistical analysis, but not really to go really deep in the analysis. We've done that for the first review, in 2018. And we found that for the second one, it was not really necessary, because what we've done is to look at the overarching and comprehensiveness of cancer plan globally, and not look at the details on specific aspect. In terms of quantification of what's in the NCCP, we didn't look at, for instance, how much countries are looking for rejection. Taking cervical cancer as an example of cervical cancer in that country. We didn't look at that because we don't know the context of a country. You don't know if a country wants to achieve 30% decrease within 5 years, or another country wants to achieve 10% in 2 years, and so on. So we didn't look at that specifically, if I understood correctly your question.
Fantastic. This has been a very rich discussion. I believe we have one more opportunity for a question. So Eduardo, you are the lucky one who gets the last question for this discussion.
Thank you very much, Kalina. It is not a question, actually. This is a point regarding the concerns and the questions about implementation and politics of national cancer plans. I am the president of the Latin American and Caribbean Society of Medical Oncology. We are one of the founding members of ICCP. And actually, the fantastic work led by NCI and UICC has one of the most important problems today for cancer control, that is the political situation. So I think that we should understand ICCP more like a movement and not this is not an organization. This is a movement trying to improve cancer control, and national cancer control plans and data are fundamental tools for that. So I think that in order to improve the situation with more collaboration, we need more political forces, more activity from the civil society, and the continuity. I think that the next forum in May in Geneva is a very good next step. And then the opportunity of the UN, during the UN General Assembly in New York, there will also opportunities to push for better national cancer control plans. And finally, this year, I think that in November in Australia, the World Cancer Leaders Summit will be another opportunity. So my comment is that at all the levels, I see here more than 100 people from different organizations and parts of the world, that each one of us has the compromise to really push our governments and really officials in different areas of health to take the national cancer control plans as a fundamental tool for better cancer control, and to take more interest from the public and the academic people that is sometimes not too much interested. Of course, that research is fundamental, but without political support, research is quite difficult to implement, mainly in different parts of the world. So thank you very much for this excellent review. I think that this is a fantastic tool to know our baseline today, and looking forward for future improvements. And thank you very much to you, Zuzanna, and also Yannick, and obviously NCI and UICC. Thank you.
Thank you so much, Eduardo. Well, this concludes our session for today. Very special thank you again to our speakers and to all of you for joining us. Please don't forget to join us for our next session, which will take place on May 8th. And we'll focus on the development and pilot of the Stronger Together peer support program for cancer patients in low resource settings. You can register for this seminar and for the full slate of seminars that you see here on this slide at our website listed at the bottom of the slide you're seeing on the screen now. Finally, to find out more about future events, upcoming events, funding opportunities, global health news, Visit our website at cancer.gov/global health. You can follow the NCI and the NCI Center for Global Health on LinkedIn. That is the end of today's seminar. Thank you all again for joining us, and we hope to see you next month. Bye, everyone.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.